Yeah, welcome everybody. My name is Dr. Tushar Deoras. I'm the chairman of the Astute Academy Private Limited. We are the renowned USMLE examination strategist as well as the medical post-graduation program in United States specialist, particularly in residency and physician associate programs. As you may be aware, there are two programs of medical post-graduation in United States. One is the residency, which is everybody knows the program. But there is another program which is equally a great program, which is 2 to 3 years program is called the physician associate. Like in India, we have the MD/MS program, which is conducted into the medical college. These are conducted in premier universities in United States. So our of today's webinar has been basically the prime objective is to make you a great doctor, is in medical post-graduation admissions. As you may be knowing, the National Medical Commission accept the post-graduation degree from only 5 countries: USA, UK, Australia, New Zealand, Canada. So if you go to any of these 5 countries, you complete your medical post-graduation, you can come back to India or you can go to any part of the world and then you can start practicing it. That is the beauty of these 5 countries. And USA is definitely leading. So today I'm going to talk about the USA more as compared to any other country, but we do all the countries in the world, except currently in Canada, they require the PR first. So you need to be a resident of Canada to apply. But airways, the UK, Australia, New Zealand, they are different. So as we progress, I will touch base into these countries also. In 2 minutes, let me brief who we are and what we are basically doing. So we are basically a company which is working in this field for more than 30 years. I was a scientist at Bhabha Atomic Research Center, and we have the excellent team in United States. We believe quality education and successful career is the fundamental right of every. So we work with the quality students. We build a profile of the student. We call it an international mentoring program so that you get admission into the premium universities worldwide. Medical post graduation is a tough admission. Everybody knows it is not an easy admission to get a medical PG. It requires a tremendous amount of efforts and the academic as well as the non-academic profile. So as we are working on many years, we have got many awards to our statute, like Champions of Change Award, which was given when the Vice President of India, Shri Venkaiah Naidu ji. This is a Niti Ayog's award. After the Padma Award, one of the most prestigious award in an education theme, I got this award. Very prestigious. Pride today, the Pride of Nation Award. This is again a great award. This was Vijay Diwas we celebrate in Delhi when in 1971 we won a war with Pakistan, and in 14 days we won that war. Bangladesh was created. More than 96,000 soldiers surrendered. Pakistani soldiers surrendered after World War II. It was the biggest surrender in the world, and they celebrated Vijay Diwas. You can see the 1971 war veterans, General Bakshi, former air chief, and all. So it's a big function. Vijay Diwas and Rajnath Singh was the chief guest, and I was honored for the contribution part of it. Nitin Gadkari ji is given many awards, including Maharashtra Gaurav Award and many of the prestigious award. Corporate Social Responsibility. Even Fadnavis ji given 6, 7 awards. Corporate Social Responsibility Award. Uttar Maharashtra Ratna was very prestigious because along with me, Lata Mangeshkar ji and ex-president Pratibha Tai Patil also got award. Very prestigious awards. We have been working more than 25 years in the education part. Vinod Tawde ji, who was the education minister of Maharashtra, gave the best career counselor in a Navbharat function. London, both houses of parliament has felicitated House of Lords and House of Commons. Like in India, we have Lok Sabha and Raj Sabha. This is a very, again, a prestigious award in the UK, London Parliament. Recently, the prestigious Shushruth Award. Shushruth, you may be knowing, is the pioneer. So they are also called the first doctors of India. So the Ayurveda, our surgery. So Charak and the Sushrut, they were the veterans of us doctors, and we complete our medical system is based on that. And our health minister at that time, Mansukh Mandviya ji, has awarded, and non-doctor, this was the only award which is given to academy, and we are working. It's a very Sushrut is one of the most prestigious award by the government. And it is a great honor because we work in lot in medical sector. In United States, Dr. Donald Martin mentors our team, the students. He was the ex-dean of the Columbia University, University of Chicago. You may be knowing these are the top universities in the world. University of Chicago is produced more than 99 Nobel Prize winners, almost like 43 years of rich experience. He was admitting students at the other side. And so we have big team of the people from the different universities who are working into that. So Astute is an organization of academicians across globe. We are also associated with a lot of hospitals in United States where we can get rotations for the students part of it. We know also we are also connected with the residency hospital. We know the admission criteria. We keeps on meeting the program directors there. So we provide a lot of complete end-to-end assistance and the counseling. So in India, we are as per my knowledge, is we are the only one academy which can provide end-to-end, because we have the big credible American team with us who is be working with Astute part of it. You know, in India, MDMS seats, it's very few seats, very difficult admissions, very costly admissions. It is also cost in India. If you get a government college, it is fine. For private and deemed universities, also a costly part of it. So National Medical Commission, as I said, except 5 countries, US, UK, Australia, New Zealand, Canada, you can come back to India and start practicing from the day one. The new education system from 2023 is a diagnose based. One doctor is better than another, how well he or she can diagnose a patient. So if you can diagnose a patient, you can treat a patient. So whether the national exit exam or USMLE exam, or UK had the earlier PLAB exam and now the UKMLE exam, or any examinations, this is based on the diagnostic skills. You will be tested now in all, even NEET PG exam or internationally FMG exams. All these examinations as a symbol is a clinical exposure. Your hospital exposure has to be great if you want to be. Without hospital exposure, you cannot become a great doctor. However, you may crack any examination, you may crack NEET examination. So higher marks in NEET does not mean better doctor. Higher marks in USMLE examination does not mean a great doctor. And that is why the national exit exam, which is expected to come next year, 2025, we are almost reaching to the end of 2024. National exit is going to be a examination, which is a clinical nature examination. So national exit in India, USMLE, US medical licensing exam. Name suggests it's a licensing. It is not the admissions exam. Many people misunderstood USMLE as the admissions exam. It is no longer. PLAB is replaced by UKMLE in UK. Australia is Australian. All these examinations are going to be same exams, 90 to 95% same. So national exit, USMLE, UKMLE, Australian Medical Commission, National Medical Commission of India has signed now the 10 years MOU with World Federation of Medical. This is the umbrella organization which decides the quality of education. It's American acceptance. 10 years, you will see the lot of syllabus changes which will be happening. National Education Policy 2020 is influenced by the American policy. So we are implementing a lot of best practices worldwide into India. And that is why the USMLE, currently USMLE and NEET PG are different examination. Now they are going to be very close part of it. And it is based on the clinical exposure part. Clinical skills is a clean. Whole world is now restructuring from 2023 part of it. So as I said, there are two medical PG program, residency and physician associate. I'll talk first about physician associate. You don't need a USMLE examination to practice in United States. It's a myth. that if you want to go to United States, if you want to go to the residency, it is mandatory that you have to take a USMLE. It is definitely a difficult exam. It is not going to be easy exam, but it is not necessary as you have to take the USMLE exam. Without taking the USMLE, and that is what is the program of physician associate. Rarely, I don't know anybody in India can have the capability to get admission into physician associate. It's a medical PG program, 36 to 42 months. Normally, why I say this duration is it requires some prerequisite subjects to be completed. Normally, if it internal medicine or normal branches, it's 2 years. Surgical is 3 years. So I always say is a higher part of it. There are 175 American universities which accept the international student. So the Indian students or the students may be studying currently in China, Russia, Ukraine, Georgia, or any other country, and they want to go to United States, this is the program. Because many students, they are not able to pass the USMLE. USMLE is not meant for everybody. Let's be very, very clear. It is not that every student can clear USMLE. And it is not only passing the USMLE, you need to get a good score in USMLE. I'll discuss about the USMLE in next slides. And this is the program which is a university program, very, very premium program, far, far better than any of the countries. It has a 3 intakes, January, March, and August. You need to do the prerequisite subject, very high salaries. This program is great demand. If you go to Google and just search top 5 jobs in United States, physician associate, they call it PA in short form, is one of the trending, almost like one. And what it requires is prerequisite material. In India, we say eligibility and clinical exposure, hospital exposure. As I say, everywhere it is about the hospital exposure. So hospital exposure in India, hospital exposure in United States. So we will take you to the United States for 2 months, 3 months, and we'll give clinical exposure into United States. We'll do the hospital here. And at the same time, we may do the virtual also. Like I'm talking to you on the virtually, we can do the virtual part of it. Now, these are the subject. Prerequisites means what? Eligibility. These subjects you need to take from American universities. So anatomy, physiology, biochemistry, microbiology. So what we do is we connect you with the American university. Even you can do these courses online. You can directly appear for exam. If you are an MBBS student, you are already done anatomy. You don't have to go to the lectures. They are recorded lectures, but you don't have to go. You just appear for the exam, go through the recorded lecture, appear for exam. You will get a credits from American university. Chemistry, organic chemistry, genetics, psychology, statistics, all these subjects. So I will give you the website. You can check the subject university wise also. This is a high level list of the subjects. Either you can do these subjects in online mode, or there are other options. So we have the Parul University in Vadodara, which get these subjects done in campus. So it's a 4 years of the program, pre-medical program after the 12th standard. So after 12th standard, you go to the 4 years of pre-medical program you do, and then 3 years into United States. After 12, 7 years, you may be a gynecologist in United States with this program. Very, very powerful program. After 12, 7 years, you are a practicing gynecologist or you are a surgical doctor. Even surgical, all branches, clinical, all branches are possible into that. There are other stream students also, homeopathy, Ayurveda, physiotherapy, bioengineering. They want to become allopathy practices. Again, this program, you do these courses. There are integrated program also in United States where the people go directly to United States in 4 years time after the bachelor's. 4 years time, you can complete this course. A lot of students going to United States to do these courses also, prerequisite. So 6 months to 1 year, you complete this, and 2 years of physician associate, or 3 years to 3.5 years, you finish based on the specialization you take. Very, very powerful program into that. So we have already launched. Either if you are passed out student, it is a 1 year full-time prerequisite. You complete all the prerequisites here in India and online. We apply to the American universities and physician associate, and we get into that. Or these prerequisites can be done alongside of your courses. So if you are a BSc student, you are a biotechnology student, you are MBBS student, you are Ayurveda student. If you are in the second year, third year, you can start taking 1 by 2, one subject from the American university. By the time you pass it out, you have all the prerequisite subjects completed. Very, very important part is the prerequisite, and we will help you everything. These are very, very easy. So as soon as your subject is finished in India, you can take that part of it into that. Now, so it can be a part-time, which is a 2 to 3 years, second year, third year, final year. Some subjects you can take and come finish it off, or you can do 1 year, you should full and complete it. It's ultimately it is. So we can integrate it with your bachelor's degree. That is the beauty. It can be done with MBBS, Ayurveda, homeopathy. So you have taken Ayurveda, homeopathy, but you wanted to become allopathy practitioner and a one doctor. You know two therapies. That is the beauty of this. Nobody, it's a very, very powerful program again. Or you go after 12th, 5 years integrated, 5 to 6 years, as I said, maximum 6 years, you will be able to complete this program. Or also 4 years if you are after bachelor's. So prerequisite plus this is one of the best programs. Those who don't want to get a USMLE, those are sitting in Russia, China, Ukraine, Georgia, or any even country, and they are not able to clear the FMG exam. This is the part which is there. Second is always the residency program. It's a free program, $5,000 to $10,000. They pay you the stipend, but it's a tough admissions part of it. Residency admissions are now the complete paradigm shift, as I said. It is no longer USMLE, USMLE, USMLE. It is required. USMLE is required for residency. Okay. But it is not sufficient. Even if you crack USMLE, there is no guarantee that you will get a residency. Even after you crack USMLE exam, you are a brilliant student, you get into that, still it is not guaranteed. The USMLE weightage is now only 10 to 15%. They have restructured exam. This is no longer it is a tough exam, but not very tough exam, because more than 90% of the students pass in first attempt. In first attempt, passing is very high. Some of the pockets in India also are going more than that. So 26th of January 2022, in fact, last year was the first batch with the new admission. American admission system has changed. Higher marks in USMLE was admission guaranteed was prior to 2023. Now it is no longer. It is only 15. Some university may give 20%. It is an important exam because this is a licensing exam. Many universities don't use this exam for licensing, but they still use this exam whom to call for residency interviews. So they will check your profile. They will check overall profile and they will be selectively called for the interviews part. USMLE is only one problem. If you pass it 7 years, you cannot repeat. So you should, when to take the USMLE is most critical. Many times students take in second year, third year, it's a waste of time. Your syllabus is not completed. And if you somehow you are a brilliant student, you pass also USMLE because the passing percentage is more than 90%. You get less marks, you are stuck with that. So a lot of changes, let's discuss that changes also. So step one, what is step one? Again, a diagnostic exam. They will give patient symptoms. They will give the reports. 4 option diagnosis, it's objective type exam. Step one is the pathology, physiology, biochemistry is almost more than 90%. And some ethics, professionalism, and other types of. It's a base diagnostic. Pathology is the base of diagnostic. So they will give the patient symptom, they will give pathology report, 4 options diagnose. There used to be another exam, step 2, clinical skills, where you have to fly down to United States, 12 chambers, 12 patients, go meet, diagnose. Very difficult exam. This is scrapped. Very good news for Indian students. No need. Step 2, CK, clinical knowledge. This is the exam most critical. So what is this exam? 60% internal medicine, 10% gynecology, surgical, pediatrics, psychiatry. Again, patient symptoms, reports, diagnose. Diagnose. If you can diagnose a patient, you can treat a patient. So your hospital exposure has to be great if you want to create a really good marks into USMLE. It is not only in India or whichever country you are there, but also you need to take a rotations, at least 2 to 3 months of rotation in United States. You cannot be 100% dependent on India. The way we diagnose in India and the way American diagnose is different part of it. This is a snapshot. So after 26 January 2022, previously you required 250 marks. Now you require just 196. It's a pass and fail step 1. If you fail it, you can retake it. Just 196. Previously, you required 230, 240, 250 marks. Step 2 CS is scrapped. Step 3 is not required. Please don't take the step 3. You should take the step 3 only in case if you get very low marks in step 2 CK. If you get very low marks in step 2 CK, then only step 3. Otherwise, don't. It's a difficult exam. Step 2 CK, you need 250 plus. It's a diagnostic exam. If you get just 214 is passing and you get 220 marks, you will not get admission anywhere. Then in that case, you have to take a step 3 to support. So step 2 CK is most critical examination. Step 1 you can pass in. So now out of 3 examination, only 1 exam is left. And that is where it is going to be the most critical. And that exam is purely clinical exam, 100% clinical exam. So 15 to 20% is USMLE part of it. Now, what is balance 85%? This is given. Research projects, very critical. You should have small research projects. You should have big research projects. So we have faculty sitting in USA and all. They will help you one-to-one. So we have mentoring program where one-to-one we will grill you. We will give you the mentoring for do the research, publications part, small projects, big projects. In India, we don't do much of the projects part. Even if we do the projects, it is not a publishable level. But then to do a research project, it takes time. You should start from first year MBBS or first year. You cannot be a final year and you coming to me, then you have to sit 1 year. You have to take 1 year gap. But if you come to me earlier, first year, second year, we can do social environmental project, US hospital rotation, letter of recommendations, very critical. From American doctors you require. Where to apply, program selection is going to be very critical. Everybody know New York City or New Jersey, California. So many applications come in New York City. Very competitive. Competition. Everybody applies to AIMS will not get AIMS admission. So it is important that you need to take that particular part of it. So you have to apply where your chances of admissions are there. And that is how the complete match process is designed. The algorithm for this admission is designed, they call it as a match, is designed by a person. This algorithm, that person got Nobel Prize for this. Understand the level of complexity. 52 parameters we need to build a profile. Now, none of the student can do complete 52 parameters, definitely. It's a very complex. But at least you should reach 35 to 40 parameters. You should be measuring so that you reach to a particular part. But many of the students don't know the process. Say in India, it is all merit list. You prepare a merit list, you are give the NEET exam, your merit list, you admission. US, it is not. Preference list is not based on merit list. It is based on your chances of admission. So you have to put really a program which is really in the match, which is a better program. Simply that. Very, very difficult. So what happens if I am a university, I get 500 application, I only call 100 students for the interviews. So first level filtering happens on this 85%. If your profile is not there, they will not even call you for the interview. Residency interview is more of a psychological interview. But if you get a good amount of residency interview, you get admissions. They filter it out. The first level of filter happens based on the profile. You may have great marks in the Indian MBBS. There is no problem. You still has to be doing all this part of it. SOAP is the second round, third round. Very complex. In a day, 4 rounds. 3 hours into 4, 12 hours in a day. Very complex. People don't understand the concept of that. We have the great team sitting who has been working on the match and SOAP process. It's very, very. But if your profile is not there, however I may be great, I may not be. Even selection of universities is very critical. Documentation, so robust documentation you have to create. Essays and all these things. In generic word, people call the CV preparation. There is no CV preparation nowadays. They don't even ask for CV. I don't know why the people call for the CV preparation. There is no CV required in any of the application process. They call it ERAS application, electronic residency application process. It doesn't require it. You have to enter a profile. So there are 10 experiences. Now you need to get those 10 experiences. You have the peer review projects, non-peer review projects, publications. So if you go through the application form, which we apply to the residency, is very complex. It's a completely different than a CV part. In generic, you may use any words, but earlier it used to be. Now it is completely different admission process. Don't talk to your seniors because they have gone through the different process. In fact, this year, March was the first admission, which is with a new process. 2024 March, the admission part of it. So USMLE, profile building, US rotation, letter of recommendation, documentation, program selection, ERAS application online, residency interview, match, SOAP, all things makes admission. So one is the profile building, what we call is mentoring part of it or counseling part of it. Another is the admissions part of it. The admissions we do in the last, but to do the application process and all, we need to create a thing. Research projects cannot be done overnight. You should start second semester of first year of MBBS. You should come to us. Now it is no longer USMLE. These are the websites. You can take a screenshot of these websites into that. NRMP is the actual residency admission. It is given past data. Everything is available into the ECFMG. We have to register after second year of MBBS if you want to take it. USMLE, as the name suggests, is examination patterns. NBME is now the National Medical Commission has signed a MOU with them. They are the paper setters for the USMLE, and now that they are taking this with our national exit exam. NMC, our website, and AAPA is Physician Associate, American Association of it. AAPA is such a great physician associate site. It has got everything. It has got university list. It has got what is the eligibility criteria, what is the prerequisite subjects, everything part of it. A residency program doesn't require you to be a licensed medical practitioner. Suppose you are going for Russia or China or Ukraine and you want to do the residency, even without coming back to India and giving FMG examination and going through the internship and all, you can directly fly from Russia to the US for residency program also. Definitely USMLE has to be cleared, but Russia, China, Ukraine, Georgia, even Philippines, many countries, even Caribbean islands, they don't have to come to India. They can directly go for residency program. So we will help you to get into the without licensing, without getting a license to practice. In India now it is mandatory. If you are going to Russia, you have to get a Russian license before you can come back to India. If you are going to Georgia, you have to take the Georgian license to come back to India. Now you can directly go from the residency program to go and practice as a doctor in United States without having a Georgian license or Russian license. Whereas you cannot come back to India. You have to get a license, you have to come, prepare for National Exit 1, do 1 year internship, National Exit 2, PG when you do. 10 to 12 years, just like that it goes. Fastest route to go to the United States. Both program, residency and physician associate. All surgical clinical branches are available. It's completely wrong. You go to the NRMP site, it is given. Definitely surgical seats are lower. Internal medicine and other seats are more. So many people get admission. This has got all covered. You can pause and look at that. None of the branches. This is a non-US IMG data, not a US citizen data. It is the international medical graduates like us in India. When to take a USMLE? So if you are not second year, third year, minimum 6 months of internship should be completed to take step 1. It's a hospital. It's a diagnostic. It is no longer theory exam. USMLE earlier was theory exam. The people used to take second year, third year or final year. Now you should not be taking it. If you fail it, you after 6 months, you are decent patient exposure, take this. But step 2 CK, which is most critical exam, you finish your internship 12 months. Don't break the internship. Don't break the internship. Go to United States, complete your 2 to 3 months of rotation, then you give it. Now process has changed. Old process was different. When the student used to take a break in between, go to USA, do the rotation, come back, finish the internship, no longer doing. Very, very critical. Don't even take, because 7 years you are going to stuck. If you pass step 2 CK, you are a good student, pass, but get less marks. You are stuck for 7 years. Don't take a risk in step 2 CK. Very, very critical. So we start with the first year of MBBS part of it. We mentor the students part of it first year. MBBS or any stream now. Physician associate has all the students on different stream. We build a profile by mentoring to the admission shortlist where you can get admission. You cannot get Stanford or Harvard, but there is another university where your chances of admission. We have to apply. We have to take a backup. It's admission in United States strategies. These are my contact numbers: 8899 117727. astuteacademy.com. You can book one-to-one appointment with me or my counselor team. Go to residency or PA. astutepromo.com. This video will be uploaded onto my astutepromo.com. You can view this video again on Astute Promo. This is my YouTube channel. So astuteacademy.com is my website where you can go. You will get all the information about it. You can book a one-to-one appointment. It's an online portal into that. It has got a diagnostic test of USMLE also. If you want to test it, your USMLE skills, you can go into that particular part. USMLE ka 3 hours ka diagnostic test is also. So we handle from profile evaluation to admissions, everything, including visa part, your travel part, your stay in United States, because we have the team in United States. We have the team, Astute Academy has the team in United States. So please do join this program. You can have one-to-one call where we can discuss more details. This is a webinar, so I want to just maybe complete into at a high level, but I will be able to do in a proper way, and then we can take this part of it. So thank you very much for joining for this session, and I appreciate it to that. And thank you very much again. Let's connect and let's make both the programs, residency as well as the physician associate, a great success. Thank you.